you may be having lateral knee pain. Okay, so this could be IT band syndrome. We're going to show you how you can find out if it is IT band syndrome on your own, and then what you can do about it. The IT band, first you have to know, is a long tendon that goes down the side of the leg. Typically it hurts if it's pulling here on the outside of the knee. Now, what you can do to find out if you're having IT band syndrome, lay on your back for me. This is Jerica, by the way. She does it all in the office, except for the exam and diagnosis. Scoot this way a little bit for me. So, again, first you're going to have lateral knee pain. So the pain is going to be on the outside of the knee, typically right in here. Drop this leg down. So what we can do here in the office is a test where I'm going to hold some pressure here on the outside of the knee, and then we'll just kind of bring the knee up through this range right here, and if that hurts, does that hurt on you?
A little bit.
Yeah, a little bit. And someone who has IT band pain, it's going to hurt significantly. You can try this on your own. Apply a little pressure there. Maybe try that hand over there, drop here, and use your thumb. So squeeze like this, and then just extend your leg down and bend up right through this range. If that increases, okay, that might be hard.
Hold on, do like this.
So go like that, yeah. So you want to extend and flex back up and squeeze right where you feel the pain. If that makes it worse, you're putting some tension on the IT band, so that could indicate you have IT band pain. Now, another one here, typically again, the IT band pain is associated with shortened hip flexors. So what we want to do, let's say again, her pain is on this side. We're going to take this leg, we're actually going to bring it up and see if this leg comes up off the ground like this. So slide up a little bit that way. Good. So I'm going to do it, yeah, so we're going to pretend like she has a shortened hip flexor on this side. When I bend the leg up like that, and you'll see as the pelvis rocks back like that, then this leg comes up off the ground too, and that's because the hip flexor on this side, the affected side, is shortened. Now, straighten all the way. The leg should stay down like that, indicating that this hip flexor is flexible enough to not pull the leg up. So that is a few ways that you can assess that on your own. Now, here's another one. Turn on your side facing that way. We're going to assess the flexibility here on the lateral hip and the IT band. So I'm going to do it for her first. So we're going to bring the leg up and out like this. You can bring your own leg up and out like this. And then what you're going to do is you're just going to let this leg drop down. Okay, so I'm going to let you go. And you're going to drop down like that. So the knee should go past the side of the hip here. If you can't do that for some reason and your leg only goes to here, that's going to indicate that you have over tightness here on the side of the leg, in the glute medius, glute minimus, IT band. Again, if you feel the pulling or pain on the side of the leg or the knee where you're feeling the pain, that again could indicate IT band pain. Now, stand for me. IT band syndrome or pain is also associated with glute weakness or hip stability weakness. So there's a few tests that we can do for that. One is just a standard squat. So go ahead, do a squat for me. Good. So come back up. Knee stayed stable. I want you to go ahead and allow the knee, let's say again that your left side is the weak side. That knee, you might watch yourself in the mirror, the knee caves in. Here, come around this way and face this way. Good. So go ahead, knee cave on the left side. That's over-exaggerated, but you'll really watch yourself in the mirror. Go ahead, come back up. Really watch yourself in the mirror and see if you notice that knee going in. Again, could indicate hip stability weakness on that side. Now let's do a single leg stance. So feet together, and you'll just bring your right knee up. Go ahead. So now go back down. Bend the knee slightly. Bend both knees. Just slightly. Good. Right knee up. Good. So her pelvis here is staying stable and her knee is staying neutral. Back down. Now, right knee up again. Now let this right side sag down a little bit. That shows that this hip right here isn't strong enough to keep that hip from falling down. See, she can keep that up. and then also bend that knee again slightly and let it cave in. So if you look like this, that indicates you've got some weakness here on this side. Good, relax. That's kind of hard to do it the wrong way, isn't it? Good. All right. So if you have IT band pain, you're going to have pain on the lateral knee. You're probably going to have tight hip flexors, and you're probably going to have weak hip abductors. So we want to reverse all of that to treat the IT band. We're going to stretch the hip flexors. We're going to strengthen the hip abductors and external rotators. So she's going to, oh, one more. Wait, this is a good one. So we're going to use a little step like this. You can do this at home, maybe if you have stairs. Stand on there with 2 feet, facing this way. Good. All right. So you're just going to keeping this leg straight. No, this is the good leg. This is the bad leg, right? So we'll keep this leg on. We'll take this leg, keep it down. Go ahead, heel tap the floor. Good. Good. Now, again, that was good, okay? So what you're going to look for in yourself is this knee to stay straight. Go ahead. And the hips to stay level. Good. This one's even harder. So now do it incorrectly, or if it was to show glute weakness, this knee caves in here, indicating that you're not able to use these muscles here on the side of your hip to support that knee. So go ahead, step down, and move this. So IT band syndrome is common in runners, cyclists, people who do endurance type activities, because when you're running and all this weight is on this leg, and the knee caves in because these muscles aren't strong enough to keep it straight. So that pulls on the IT band, giving the pain down in the knee. Let's do the hip flexor stretch before you get on the table. And here, I'll give you this one. Let's do it facing forward, facing the camera first, and then we'll go to the side. So she's going to take a knee on the bad side. First thing she's going to do, hands on the hips, she's going to tuck her pelvis underneath her. Good. And then she's going to lunge forward, keeping that pelvis underneath her to, again, if the pelvis goes back, then you're really not stretching the hip flexors very well. Take the same side hand on the knees is down, and then flex the lumbar spine laterally to get a little extra pull there on the lumbar spine and on the psoas and the iliacus, two of the main hip flexors. So go ahead and come back up. Now turn facing that way. We'll give you a lateral view. Again, take a knee on the side that's affected. She's going to tuck her pelvis underneath her, take a lunge forward. You should feel the stretch right here in the front of the hip. Take the same side hand and reach over. You feel a good stretch with that? Mm-hmm. Perfect. Mm-hmm. All right. So you're going to do this, hold 10 to 30 seconds. You should feel the stretch right in the front of the hip. Okay? Now, next we're going to do an exercise called the Clam Shell. And you can do this with a band. Do bands here? No, that's okay. We'll just show them the Clam Shell. All right. So we've been saying the affected side is the left side. But, yeah, go ahead, flip around. So what you'll do, you'll bend the hips at 90 degrees. You'll bend the knees at 90 degrees. The Clam Shell, you're going to open the hips and knees and toes, keeping the hips stable here. So all that you're moving, you're pivoting at the hip. You're opening the hip, the knee and toe. You should feel this in the back of the hip. Okay, you're increasing the stability and the strength in the muscles that are going to support so that the knee doesn't fall in like this. Again, how many? I like 3 sets of 15. You can add a band to this to make it even harder. This is external rotation. You're working on external rotation of the hip. Okay. So another exercise that's great for external rotation, you can do it with a band as well. It's called the Fire Hydrant. So people ask, why is it called the Fire Hydrant? You'll see. So you're going to get on all fours, and you're going to use, again, the affected leg. You're going to hike it out to the side. Again, we're working on a little bit of abduction and external rotation here. You should feel this in the back of the hip. Again, you're also getting a little bit of stretch on the adductors and internal rotators. Again, I like 3 sets of 15 here, but there's no magic number. Add a band to it to make it more difficult. And the last one we're going to do is abductor strengthening. So you're going to lay on your side, affected leg up, you're going to rotate the hip slightly so that the toe points down towards the ground. She's got a lot of rotation here in her hip, so she's able to point her toe all the way down. I can't even do that. So probably a normal person is going to be a little bit more like that. You're going to drive the heel up towards the ceiling and back down. What we don't want to see is you start here and then bring the toe up. Okay, you're not working the abductors anymore when you do that. Toe has to stay at least straight forward, preferred to be down. So go ahead, show them here. Now you can also do this with a band around the knees, a band around the ankles, to again work the hip abduction, create stability so that the knee is not caving in, pulling on the IT band. And lastly, let's do banded side steps. You get the band, you can put it around your knees for easiness, or you can move it down to the ankles to increase the difficulty, or feet to make it even the most difficult. And of course, there's all different sizes and shapes and tensions in the bands. She'll start here. Move over this way and face the camera that way. Good. All right. So band around the knees. So the right way to do it, take a little bit of a squat position, side step one way, and then back. Good. Now, incorrect would be go that way and let the bad knee kind of cave in a little bit. Yeah, good. Now back. Good. And then back, and then let the knee cave in. So, yeah, so what you want to do is don't allow your knee to shift in. Keep the knees separate. Go ahead, keep going with it. Keep the knees steady and separate as you're doing this. All right? So, you know how to assess yourself for IT band syndrome. You know how to stretch your hip flexors. You know how to strengthen your abductors and external rotators. The other thing, obviously, that we can do in the office is mobilization of the hip and knee joint, as well as the pelvis and lumbar spine if necessary. But at least now you have the tools to work on this yourself. And if you need any other additional treatment, definitely seek out a provider in your area that can help. But if you have any other questions about IT band pain or syndrome, please leave them in the comments, and we'll get back to you as soon as we can. Thanks for watching.